is Chase.
Okay.
I am originally from Salisbury, Maryland.
Okay.
I currently live in Los Angeles, California. I'm an actor and a singer. I started out in theater, but with my recent move to Los Angeles, I want to start focusing on film and TV.
Okay.
And the hair transplant is really going to help with that.
How long have you been in LA for?
A month.
A month. And I guess, as an actor and a singer, people, put a lot of weight on their appearance as far as, that's the way that people perceive them. So I guess for you, as trying to become a famous actor at some point, this makes a big difference for you as far as, roles and everything else. What age did you start losing your hair?
I would say around 21.
Okay.
Yeah.
And how old are you now? You don't mind me asking?
I am 29. I will be 30 this year.
Oh, okay.
So this is kind of like my 30th birthday present.
What a nice birthday present. Excellent. Okay. What are you hoping to accomplish today? What's your goals? Obviously to have hair, but...
To have hair, to have a relatively youthful-looking hairline, for the reasons we just discussed.
Okay. Excellent. And tell us about your research. How did you come all the way from LA over to Florida to pick us? Who did you look into, and why did you decide on us finally?
Well, I looked at a few doctors there, and they're all really good. Obviously, it's LA. They know what they're doing, but they are rather expensive. So,
okay.
I found you over YouTube.
Okay.
And you obviously know what you're doing, and you're doing it very well.
That's all we do.
And
yep.
it was at a price that was...
Okay, so our pricing was more competitive than, say, someone in LA or Beverly Hills, something like that. Yeah. And I'm going to guarantee you we're going to do just as good of a job, if not better, and move way more hair than they'll ever move for you. Right. So thanks again. We'll be following Chase's progress throughout the surgery day. And thank you again, Chase, for helping other people out as they're researching the process.
Of course. Okay. Thank you.
Okay, so I'm here with Chase, and at this point in the procedure, Chase is coming in for more hair and leaving with less, right? So, and he also allowed us to shave his head. Now, he had his hair cut pretty short, so we're kind of just talking about the strategy. Now, you can see the new hairline that we've drawn on him, so it's just below the hairline that he had, but you can see how it's going to really reframe his face. He decided also to do temples today, which I think is the right decision for someone like him. He wanted less of a forehead, and now he's in the entertainment industry, so profile is everything. So we're going to do that. And then we basically divided the head into three areas. Here we got a frontal third with temples, center portion, and crown. And we've elected to do the frontal third and then do the crown in the next priority of events. So, if for some reason we have more hair, then we'll try to fill in the middle and try to connect the dots. Just depends on his elasticity, but we're really going to move as much hair as possible for Chase. Couldn't be more excited to do this surgery. And
absolutely.
He also is indicating to me he just started a blog and I think an Instagram account. He's going to be kind of documenting this on his own too.
Yeah.
So that's exciting to share that with everyone. So
the name of the website is thehairchase.com.
Thehairchase. That's very clever. That's very clever, Chase. All right. So anyway, we're about ready to go. We're going to give him a little Valium, I think, today. Are you going to take Valium today, Chase? I didn't even ask you.
No.
Okay.
I don't think I need to.
Okay. If you change your mind, we have it available to every patient. And looking forward. Thanks again, Chase.
Cool. Thank you.
Okay, here with Chase, and at this point Chase has had his strip removed and he's all sewn up, and in Chase's case we're really happy because we were able to get a third additional strip, so this is a Hue Plus. Awesome. So this is where we just go for more and more hair, and you can see, again, where we're drawing the hairline and everything. But overall, Chase, how's your day been going? How much pain are you in? What's it been like?
It's been fantastic, actually. I'm in little to no pain. The only pain that I experienced is at the beginning when they have to administer the anesthesia.
Right.
But it doesn't hurt any more than like when you get a vaccine in your arm or something like that.
Mm-hmm.
So awesome. After they do that, you're basically not feeling anything. And even if you do think you feel something, they stop everything and take care of it. So there's nothing to worry about. It's awesome.
Well, thanks again. So you're about a third of the way through, and we'll be checking in later.
All
thanks.
right.
Yep. Okay, I'm here with Chase, and we have just completed the surgery. Chase, how do you feel? How was your day?
It was fantastic. It was awesome.
Okay.
It was a long day, but it was a really good day.
Yeah, it's a little over 6 hours, and we did a Hue Plus in Chase's case, so we got him. This is probably one of the top 5 that I've done as far as the most amount of hair moved. So anyway, I want to kind of show everyone what we did. We drilled out his temples on either side. Nice staggered hairline all the way around. The line below it, that little red line, is where we did the anesthesia, so that's just a bruise that'll go away, but the actual grafts you can see as those little bumps, and each one of those represents multiple hairs, except the frontal hairline, of course, which has 1 and 2 hair grafts. Single hair grafts rather than 2 hair grafts behind it. You can see how far back we got. And, look at the crown.
Looking good.
Where else can you go to get that much coverage? The only area that we didn't get is a little, maybe 2-finger width area in the center, where he already has some hair there. And, you know, in front and back, you're going to get coverage in that area just because of the nature of how the hair is angled. So now you can see his incision again. I don't mean to gross anybody out with these videos, but I just we like to show everything. So he has, as you can see, a little bit of oozing, but you can see the tiny line, the tiny scar he's going to have. And like I told him, he's an oozer. Some people just have more blood to the skin. So, and this is literally immediately after surgery. So all this little oozing will stop in about, a couple hours.
Got up from the chair 5 minutes ago.
Yes, exactly. So, but thank you again, Chase. And now we're really looking forward to your results. Anything you would tell people that are scared to get a hair transplant, or, what would you tell people that are anxious about doing the procedure?
It's not as bad as you think it is.
Yeah.
Honestly. It's like I said, it's a long procedure, but it's well worth it in the end. I am so happy I came, and I wouldn't change it for anything.
Excellent. Thanks for the kind words, and hopefully we can see you on the silver screen soon.
Yeah, let's do it.
All right. Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.